Some viewers may find the following video disturbing. Viewer discretion is advised.
Take me to the garden of your ecstasy. Make myself a heaven from your fallen leaves. Woven in the fabric of your time.
Welcome everyone. Go. Acción. Here we go. Welcome to another wonderful episode here, Doctors of Podiatry. We have a great case for a lot of great reasons, because this is the clinical presentation. A lot of people, battle the heel pain, right? Also known as plantar fasciitis, plantar fasciosis, heel pain syndrome. A lot of people battle this problem. Okay, and I would say when we talk about the treatments in our toolbox, there's only so many, right, that we have and can use. But there, as some of you may or may not know, I'm very keen on regenerative medicine. We do have different types of procedures and protocols in place for chronic cases of heel pain, such as this one. So, again, in respect to the conservative treatments, the cortisone shot, the orthotic, the ice, anti-inflammatory, the physical therapy, some of these may or may not work. It really depends on the person. This particular patient has exhausted everything, right? So, but nonetheless, she's here. She came to see us, and I recommended what I like to call a percutaneous microtenotomy, also known as an acupuncture type of technique, and you guys will see why. And number two, we'll marinate the area with PRP, platelet-rich plasma, just to refresh everyone's memory. Basically, draw blood. We spin the blood in a centrifuge. The blood separates into good and bad. The bad we throw away. The good we keep. In the good, we have the PRP, the platelet-rich plasma. The plasma contains growth factors. The plasma contains important cells that aid in the regeneration of damaged tissue, helps reduce inflammation, and so on and so forth. I want to be very clear with the public. PRP is not stem cell therapy. Very, very important. Okay. And I think that that's something very, very relevant, because a lot of people do believe that. So please do your homework. So we have here, okay, a little bone model. We have the calcaneus, the heel bone. Basically, the plantar fascia, the longest ligament of the foot, runs from the calcaneus all the way here. Okay, make believe it's kind of like the spring of a car. Now here in our little whitey board, I put we're looking at this. Right, the bottom. So the heel bone is this, and now we're looking at it like this. Okay, so this is the ligament, the plantar fascia, and I have already demarcated, okay, the area where the patient has the most pain, which is you guys will see it looks exactly like this with the tiny little dots. The patient is already numb. This is a procedure that we do here in our office. Again, it's a two-part procedure. We're going to go ahead and do the percutaneous microtenotomy, also known as the acupuncture. We're going to go ahead and use this tiny little needle, and we're going to fenestrate the ligament, the plantar fascia. And the reason why we do that is because we want to make sure that we trick the brain into believing that there's a new injury. If the brain believes that there's a new injury, then the brain will actually we'll just keep it in lay terms, the anti-inflammatory cascade to heal the quote-unquote new injury. So we are recreating an injury. Now, once we do that, which is part one of the procedure, part two of the procedure is the infiltration of the PRP, the platelet-rich plasma. This is not a miracle procedure. This is a procedure that I like to call a physiological procedure that takes time. And people these days want everything yesterday. That's the biggest problem. We're living in this world of yesterday, and today, right? Uber Eats. What else? Uber Eats, Amazon Prime, everything is immediate. So, without further ado, let's go.
Primero plasma.
No. Primero es la acupunturita esta que dicen. O sea, primero me van a maltratar.
Okay, everyone, so here we go.
You're filming. Okay.
Yes, we are. And go ahead. And
Action.
there we go. So again, just like the whitey board, here we have, again, patient will feel pressure, right? No pain.
No.
We have demarcated the area, okay? And these are the little dots, okay? So we're gonna go ahead and use our little needle, okay? And just kind of go like that. There was a little squirter there. Totally normal because there is a little bit of anesthesia in this area here. Patient, you're doing great. I love this stuff.
Chillax.
Chillax.
Chillax, yeah.
Yeah, everyone's got to chillax. Chillax. Okay, so second part of the procedure, the infiltration of the
Plasma.
There we go. I love when patients interact. This is great. So, you know, what we're gonna go ahead and do is we're gonna go ahead, okay, and just basically start infiltrating a little bit of this plasma here. Okay.
Claro que sí. Claro que sí. ¿Cómo iba a hacer yo esto sola?
Would you like to sing?
No. But you should tell your patients to bring always someone that they love very much.
Absolutely.
I would have been crazy to do this by myself on Wednesday.
You're doing great. We have a great team.
No, I know. But I'm squeezing him a lot. I wouldn't want to squeeze someone.
But
from your
why?
hand.
If there are, I mean, are you feeling any discomfort?
No, I'm just.
I guess you love him very, very much that you're squeezing him a lot, right?
Yeah.
Okay. That makes sense.
It's just anxiety. You know, it's just like the thought. Oh, okay. I feel it there.
Here?
Yeah.
What do you feel?
No. I think that you're just like
Oh.
pressing, like pressure. Like,
Pressure. That's normal.
That's
yes.
it. No pain.
Good. I don't feel anything either. Don't worry. No pain.
No pain.
Excellent. The patient is, she was asking us to already kind of like prepare like a drink for her. That's a first one, sort of.
Uy. Are we done?
We're all done.
Okay, everyone, so we're all set. We're all done. Patient,
Survived.
that's a
First.
That's a phenomenal adjective. Survived. We went into the jungle and survived, right?
Oh, because the shark came, right? Isn't this the joke?
Absolutely. Ba-dong. So we're all set. We're all done. So very important, something that the patient was asking me right now. Now what, right? You know, sometimes I recommend that the patient for the first week take it easy. The patient already has a boot here, an ugly boot. We'll be using the boot for 1 week. I recommend that patients maintain weight-bearing status to a minimum. Patients can walk, but very mindfully, okay? So the patient will do that during the course of the first week, and then eventually will come to see us next week. And then we'll talk a little bit more on the post-procedural protocol. Chronic heel pain. A lot of people battle this problem. Ladies and gentlemen, you're not alone. There are a lot of treatments out there. Ask the right questions. Do your homework. There are other treatments that are available. We'll just say more atypical treatments that can definitely help. And of course, a lot of people have seen the last resort, which is the percutaneous, right? The percutaneous plantar fasciotomy, where we release the ligament a little bit. That's a winner. We will continue to do what we do. We will continue to educate the world, one foot, one
At a time.
heel,
At a time.
and one toe.
At a time.
Cut.
Me tienes que pagar porque aparte.